Hello, welcome to Hurst Review. I'm so glad you're joining me today. Hey, we are going to go over some NCLEX style questions together. Before we do that, I want to talk about that NGN. First of all, my name is Robin. I have been nursing for 29 years. I have been a part-time instructor for the past 10 years with Hurst Review, and I help out in the marketing department. I love working with nursing students, so I'm glad to be with you today. Hey, hop in this chat box or in the comments and let me know where you're joining me from, okay? I would love to see where you are. So let's talk about the NGN. Hey, it is here. You have 5 hours to complete your exam. You will have a minimum of 85 questions and a maximum of 150 questions. Let me tell you how you can pass the very first time. Our founder, Marlene Hurst, she is a nurse. Throughout our company, you will find a nurse working in almost every department. So you see, we know what you're going through. We have been right where you are. We're all nurses. We all had to take the NCLEX. We are a company built by nurses for nurses. The nursing profession is the only profession that we work with. That's what makes us so unique. 9 out of 10 students tell us they would recommend us to their friends. They have great success with Hurst Review, and they love to share that. We love this number at Hurst. We have a 98% plus first try pass rate. If you do everything we ask you to do, you will enter the testing center with a 98% first try pass rate. Now, isn't that great news? For over 30 years, we've been helping nursing students just like you pass the very first time. Now, if you do not pass the first time, let me tell you what happens. Your odds decrease. The NCSBN tells us that they decrease to around 45 to 50%. Y'all, that's a lot. We never want to be put in that category, so let's pass it the very first time. It is a safety test. That is what it is. You've learned all of this knowledge in nursing school, but it is a safety test. They need to know that you can keep everyone safe and alive before you just get a license in your hand. That's so important. And it is unlike your nursing school test. But guess what? Hurst Review will help you master that. They will help you with all of that knowledge that you have from nursing school. They will help you transition into that practicing nurse. And we will help you answer questions the NCLEX way. Now, with any of our reviews, you would get a workbook. This workbook will become your study guide once it's all filled in. You will use it throughout the review. Again, with any of the Hurst reviews that you take, you will receive the fabulous workbook. Students love it. The only way to get it, though, is to sign up for a review. It is broken down into segments, diagrams, lab values, pictures, tips and strategies. All of that's integrated together. Fill in the blanks. That's going to help you stay focused with your instructor. And once you complete your workbook, that will become your study guide, and that's what you will use to prepare for the NCLEX. We get you critically thinking and using good clinical judgment, teaching you that content in a way to pass the very first time. Now, there is a misconception, and that is that we are only a content review. Well, let me assure you that we are more than a content review. We are a comprehensive review. Y'all, we have everything you need to pass the very first time. We have been in this business for 36 years. This is year 37, I believe. So, Hurst Review knows what works. Okay, so we are going to put a question on the screen. I want you to chat your answers, and then you and I will go over the question together. Your first one is going to be placing your clients in order of how you would go and see them when you come out of shift report. Here we go. Okay, guys, let's read this question together. In what order should you, the nurse, assess assigned clients following shift report? Place in priority order. When you look at this question, it's asking you to place them in order that you would go see them following shift report. Now, you see that word priority? One of the ways that we teach you to answer priority questions here at Hurst Review is to pick that killer answer. That's right. So as you look at the options, you have got to assume the worst with each one of these and ask yourself, who could die first? Look at option number 3. Client diagnosed with Addison's disease who is lethargic and has a blood pressure of 86/48, a pulse of 120, respirations of 24. Are those vital signs normal? Are they? No. One big teaching point at Hurst is to know the signs of shock. You need to know your signs of shock. Hey, what happens to the blood pressure? It drops, right? What happens to the pulse? Well, it increases. So that looks like shock to me, doesn't it to you? Also, we teach you that when that systolic blood pressure drops to below 90, we want you to panic. This client does not have enough pressure to perfuse the vital organs, right? This client is showing signs of an Addisonian crisis. But you didn't even have to know that this is your top priority client. Look at option number 1. The client diagnosed with respiratory failure who is on a ventilator and requires frequent sedation. Well, I bet you see those words respiratory failure and you want to go see them first, right? It also tells you they're on a ventilator. The client's airway, y'all, is currently stable. It is protected, right? Yes. But they do need some close monitoring because of that frequent sedation. We would need to go see them second. Look at option number 4. Client diagnosed with lung cancer and iatrogenic Cushing's disease. ABGs 7.35, your pH, PaO2 88, CO2 44, your HCO3 is 22. You've got blood gases here. And is this a normal ABG right here? Yes. Now, what do you know about Cushing's? Well, we know the client has too many steroids, right? You see that word iatrogenic? What does that mean? That means that it was caused by some type of intervention or a treatment, right? Do you think that a client that has cancer, a client that has cancer, do you think they're going to be receiving some steroids? Absolutely. And the steroid use right here could have led to Cushing's. So we need to go see this client third. Now, look at your number 2 choice. Client 2 days post-thyroidectomy who has a negative trousseau. What is that? This is when you put the blood pressure on and you pump it up, and what happens? The hand starts to tremble, right? Well, is that normal? No, it does not. That means that there is irritability, right? We want to see a negative trousseau, right? Well, it tells us we've got a negative trousseau right there. So that is going to be the last client that we would go see. After a thyroidectomy, I'm really concerned right there about that calcium level, because after a thyroidectomy, if they removed a couple of the parathyroids, what could happen? The calcium level would drop. So that's why we're worried about that client, but we have a negative trousseau, and that's a good thing. So you should go see them. 2, 4, 1, and 3 is what your blanks should look like. Now, let me ask you something. Since we're talking about steroids right here, we were talking about that with that Cushing's disease. If you were to take your exam tomorrow, do you think it would be important for you to know the 4 actions of your glucocorticoids? Absolutely. Listen, if you do not know the 4 actions of your glucocorticoids, you're going to get some of your questions messed up. You're going to get some of your Cushing's and your Addison's questions messed up. So these are things that you have to know without a doubt or without hesitation. So if I was to ask you the 4 actions of the glucocorticoids, the first one that should come to your mind is they change your mood, right? Absolutely. They change your mood. What else do they do? Think about your steroids when you're giving a client steroids. They alter defense mechanisms, right? They inhibit insulin and they promote the breakdown of protein, and fat. So see, you need to know there's a certain amount of content that we want you to know without a doubt or without hesitation before you go and sit for your NCLEX. Okay, let's look at number 2. Select all that apply. This is how I want you to answer it. Listen, on a select all that apply, you could have up to 10 options. There's no limit on how many could be correct. It could be one or it could be all of them. We want you to read your question, approach each action or each option as true or false, and pick all the true as your correct options, okay? Now, remember, on the new NGN, you will receive partial credit. Make sure you look up and read about the partial credit, okay? Here's your question. I will be right back. Okay, here we go. An unresponsive 13-year-old is brought into the emergency department. Based on the nursing assessment and the current lab data, which interventions would be appropriate for you, the nurse, to initiate? Select all that apply. Hey, this is also called an exhibit, right? The format. You will have an exhibit tab that you can click on, and it's going to open up and give you a whole lot of information. Do you think it's important to open up that tab and look at it? Absolutely. Why wouldn't you look at it? You want to get all of the information you can about that client, right? You could have extra nurses' notes, lab values, things like that. Okay, it's also that dreaded select all that apply. So let's look at it. Let's figure out what's going on in the stem of this question. When you look at it and you look at that exhibit information, listen, this client is in DKA, right? They are in DKA. So they are experiencing Kussmaul respiration. So let's take our knowledge of DKA and let's answer this question together. Administer KXLate. Is that true or is that false? First of all, what is KXLate used for? Well, to decrease potassium, right? Is the client's potassium high? Well, it's a high normal, right? Listen, wouldn't you, a client that is experiencing DKA, aren't they going to be receiving insulin? Absolutely. Think about what's going to happen when you start giving insulin. What is it going to do? It is going to drive the glucose and the potassium where? It's going to drive it out of the vascular space back over into the cell, right? So if you're giving insulin, that can cause that serum potassium to drop, get critically low. So you don't want to give a medication, KXLate, do you? That's going to make it go low as well. Number 1's false. Number 2, are you going to initiate an IV of normal saline, 1,000 milliliters with regular insulin, 100 units at 10 per hour, 10 milliliters per hour? What do you think? I think number 2 is true. What do you think? Do you see in the stem where they are experiencing polyuria? Yes. At Hurst, we teach you polyuria equals shock. I want to give that normal saline because, first of all, that is an isotonic solution. It's going to go where I put it. It's going to go in the vascular space. It's going to stay there and rehydrate my client, right, and bring their blood pressure back up. Do you see those vital signs? Looks like shock to me. So, does the client need insulin? Yes. The glucose is high. So the client's going to need that insulin. Number 2 is true. Number 3, start oxygen at 2 liters per nasal cannula. True or false? Y'all, that one's false. Why? The client's O2 is 96%. Do you see that right there? When do we worry about oxygenation? We don't worry about oxygenation until it's less than 90%, okay? That one's false. There's no need for us to go hyperoxygenate this client. Number 4, start a second IV for fluid resuscitation. What do you think? I like that answer. That's true. Why? Well, clients in DKA, we're going to get them 2 IVs, and we're going to run that normal saline, y'all, as fast as they can tolerate it. The client is dehydrated right here, and they need to replenish quickly, don't they, to keep them from going into shock. We want to combat that shock. Number 5, are you going to insert an indwelling urinary catheter? Well, I like that option because don't you think you need a way to measure the client's urinary output? So, yes, a urinary catheter would allow us to do this. With a fluid problem, INOs are always an appropriate action, okay? So, there's your correct options. Now, let me ask you a question. If you don't know your content like a brand new nurse should, do you think you could answer these questions? Probably not. You have got to know that core content without a doubt and without hesitation, okay? You've got to have that so you can apply that knowledge to a lot of different questions. So since I said a brand new nurse, what am I talking about right here? Well, a brand new nurse, we want you to think NCLEX, okay? Think NCLEX. You have got to assume the worst. You have got to assume that something really bad is happening in every test question, okay? Safety, safety, safety. There will always be a safety issue, and you've got to fix the problem if you can. All right, moving on. Question number 3, select all that apply. Let me know your answers. Okay, let's read this question together. You are the nurse caring for a client in the emergency department who presents with hematemesis. What information is most important for you, the nurse, to obtain during the initial assessment? Select all that apply. First of all, what is hematemesis? You need to know what that is, right? That is vomiting blood. So if you assume the worst, what are you worried about right here? You're worried about hypovolemic shock, aren't you? Absolutely. So let's look at the stem of the question. It says initial. So you were looking for assessments that would help you quickly pick up on if the client is going into shock and fix the problem, right? We've got to fix the problem. Look at option number 1. Vital signs. Well, the vital sign, that would give you this information, specifically the blood pressure and the pulse. The blood pressure will go down and the pulse will go up. Number 2, bleeding history. That one's going to be false. Why? That's good information to know, but not initially. Same thing with current medications. Good information, but initially, that's not going to help us know if they are in shock. What about urinary output? Absolutely. Good information. The level of consciousness. These are assessments right here, number 4 and 5, that will pick up on and treat shock. That's going to help us pick up on it and treat it. The kidneys won't get good perfusion. So the urinary output's going to drop. Also, brain perfusion, it's going to go down with shock. So their LOC would go down. So your correct options are number 1, number 4, and number 5. Okay, wasn't that fun? Let's move on and talk about some options we have with Hurst Review. Okay, Hurst Now. Move on to the next one there, Thomas. I'm going to start with that Hurst Now and Hurst InStream. Hurst Now is a guided self-paced video. Hey, that lets you work at your own pace. You get that fabulous workbook I told you about and that excellent nursing support from Hurst Review. Hurst InStream is a live review that comes to you in a streaming format. It is a favorite of the students. You would get to interact with your student in real time. The student would get to interact with the instructor in real time. You could ask a question and get an answer in real time. We have very many of those. You would have to check out our website for scheduling. Very convenient schedules, a lot to choose from. They are all taught by Hurst's expert faculty, but let me tell you this. On Hurst InStream, once you finish that review, in your account, you will have a 14-day pending access that you will be able to go back and access whenever you choose to, and you will get to rewatch that live 3-day core content as many times as you want to in a 14-day period. Students love the Hurst InStream, and I know you will too. All right, Hurst Elevate, that is a companion course. We call that your study buddy. That's right. Listen, it is extra special. We love it. It is a companion course for RN or PN with any of the reviews that you sign up for. It dramatically decreases test anxiety. How wonderful is that? It's going to guide you through the study of Hurst once you complete your formal review. It's going to help you with clinical judgment skills, extra modules, lectures, high-level quizzes, and a lot of NCLEX study tips. The next slide, PayPal, Google Pay, and coming soon is Apple Pay. All right, those are just some options that we want you to know that are available for payment. NCLEX free events, if you're not participating in all of those, you need to follow us. Listen, Hurst Review has over 12 topics. Free events, you can go to hurstreview.com/free-events. The QR code right there. Hey, listen, you do not want to miss any of those. Invite your friends. Make sure you're following Hurst Review on all social media outlets as well. My friend Ashley and Sarah, they love to keep you up to date on what's going on in the Hurst world and the NCLEX world. And guess what? They'll give away free stuff every now and then. You don't want to miss out on that. Okay, free 2025. That is going to get you $40 off of InStream, $25 off of Hurst Now Plus, and Acid Base Essentials. Check out the website, Acid Base Essentials. If you struggle with that, there is a 4-part series that will make it so easy for you. HurstReview.com. Check us out. There is our home office phone number. If you still need additional help once you check out the website, feel free to call us. Someone here will always answer your question. Guess what? I'm fixing to give away 1,500 practice questions, a QBank, okay? If you are registered and you've never won before, you will be eligible. So my friend Thomas is generating me a person right here. All right, and the winner today is Cindy. Cindy, I'm not sure how you say your last name, G-U-O. Cindy, you are the winner. Congratulations. Hey, we have all your information because you registered. We will get this to you in the next 3 to 5 business days. All right, guys, that's all we have for you today. Please come back and visit us again real soon. Check out all the free events. Don't miss any of them. Okay? Take care, be safe, and we hope to see you again real soon. Bye for now.